Well, we're excited to be back with Dr. Chamberlain, Froese. And you know, one of the things that really impacts me about you is that you don't just talk the talk, but you live it. You live in Uganda 8 months of the year. And I know as an obstetrician here in Canada, you could be making quite a bit of money if you were here. So 8 months of the year, you're there on the front lines seeing it. Why did you make that sacrifice?
Well, as we talked about earlier, it's not okay that mothers die from pregnancy-related complications, and babies die too. I mean, many times babies are stillborn because their mothers weren't cared for during labor and delivery. And so as a Canadian obstetrician, I really felt called. This is what God wanted me to do. And I love what I do. I really enjoy it. And yet at the same time, I realize there's this huge gap. And every time I come back to Canada in the summertime and I walk into my fully stocked room with all the things that I need, if I need my little portable ultrasound, my monitor there to listen to the baby's heart rate, there's such a gap between what we have in North America and the Western world versus places like East Africa. And it doesn't have to be that way. And it doesn't have to be high tech. I think there's a real push even here in North America to make things a little less high tech. But it needs to be safe. And I think every mother deserves a safe and dignified delivery. So it's not okay. And that's really why I go. And it's by God's calling. And I love what I do.
Well, you know, we're asking people to give this week, and sometimes here in North America, there's a gap. You know, they don't get to go there like I get to go there, and I get to come back and say, you know what, I've seen the work. I know it's credible. It's making a difference. You know, it's hard for people to realize when I give my gift, what happens on the ground? What is the difference? So when people give this week, what is the difference going to be for you on the ground in Uganda?
Well, as Dr. John shared with us, there's very physical needs. We need to have equipment, we need to have medication, we need to have power, we need to have water. Those things are a given. But it's more than just that. It's also about a system. It's about making sure that the health workers are trained, not only in the skills, but also how to treat people. You know, I always say, it doesn't matter how poor you are. If you are slapped, if you are mistreated when you go into a facility, and I know most people here would not believe that a midwife could slap a patient, but I can tell you I've seen it before in the developing world. If you are mistreated, next time you will vote with your feet and deliver with an unsafe situation and by yourself or with someone who's unskilled. So I think, again, it's more than just even the equipment. It's also about making sure that the mothers are looked after and that the health workers are trained in both the skills as well as how do we care for patients.
Changing the whole culture. And you know,
Absolutely.
yesterday you shared with me something that really touched my heart about your daughter who watched this program, who lives it with you there in
That's
Uganda,
right.
who said, don't let the mums die. And she's praying something. What is she praying?
Well, I should also say that little girl is also a Ugandan. She is our adopted daughter. So she knows what it is for some part of her life not to have a mother, because we didn't get her till she was almost 4 years of age. But she said, Mom, don't let the mums die. You know, let me give $10. In fact, let me give $1,000. And I'm like, well, Hannah, you don't have $1,000. But I said, Hannah, I want you to pray that someone will give $1,000 for you. And so we did that. We prayed one morning before I came. And so, you know, she's a real little gal of faith. And I think God's going to move somebody, in fact, maybe even 10 people to give $1,000, you know, and that little girl knows what it means not to have a mother.
Well, if you think that God's going to use you to answer that prayer today, we would love that. I know that God will answer Hannah's prayer, and we have faith about that. Call the number on your screen, 1-888-288-0003, or go to crossroads.ca.